A dental implant is a titanium screw, essentially, that replaces a missing tooth. It's put into the jawbone, and then after a period of healing, usually about 3 to 4 months, a tooth can be put attached to that implant. A person might need a dental implant if they've lost a tooth, or in some cases, many teeth. And obviously, losing a tooth can lead to a decrease in function. You can't chew properly, and so replacing the tooth becomes very important to better function. For dental implants, the treatment process usually begins with a good diagnostic evaluation, visual examination, as well as x-rays. But really most important in today's technology is a CAT scan of the jaw. And we have what's called the cone beam CAT scan machine. And it's really critical to have a 3D perspective of the bone so that you can measure the implants properly. You can measure the bone height and width and know where critical structures are. You can see, the quality of the bone, and you can determine the proper sizes of implants to place. Recovery time is typically not too bad. Nowadays, we see patients doing great within a day or two, maybe some minor discomfort, maybe a couple of ibuprofens. In the consultation process, I begin with asking the patient if they can tell me what they're looking to do and what their interests are and what their goals are. So first I want to hear from you, what it is that you'd like to see your mouth end up like, what you would like it to look like, and what you would like it to feel like. And from there, we start to talk about different options. The best way to find out if you're a candidate for dental implants is to get a consultation. We provide a free consultation to determine whether you are a candidate and what the best protocol would be.